Any stretch, discomfort, pain?
No, that's good.
Good, and then come on back up. We'll end up doing one more, and then we'll recheck your motion afterward.
With this little bit of a twist motion, she's activating those muscles.
There's some exercises that don't always work for me, so we have to keep trying until we can find one that does work. The staff just focuses on getting you better and finding the exact exercises to help you work out of your pain.
We're doing physical therapy for patients that have back and neck pain. That's our specialty here. That's what our therapists are most familiar with. That's where their continuing education is. On average, each appointment's going to be 45 minutes or so that a patient's going to be here.
It's a team approach. I can learn from her what her body is telling her, what she has experienced, and I can take my experience and apply it to what she's told me.
Oh, it's team, it's compassionate, it's driven, and they educate you as well.
I have had for 13, 14 years now lumbar spine issues, and those lumbar spine issues manifest themselves by way of sciatic nerve pain in my leg.
There's no cookie cutter approach to physical therapy. You can't treat everyone the same. Just because he had leg pain does not mean that the same type of presentation with a different person is going to be resolved in the same way.
It's a Repex table. We use it mostly for lumbar disc problems. A lot of times people can't do the repeated extension due to arm problems. Other times they need a lot of repetition in order to get the reduction in pain that they're looking for. Also, the repetitive motion helps to stimulate healing.
For me, it's easily to quantify, right? It's results. That's all I really care about. I want my pain gone, and I want to be active. I play beach volleyball, I do a lot of different sports, and these guys keep me in the game.
The most important thing to know is when you have back or neck pain is to get in sooner. Don't ignore it. Again, we're talking about surgery, or we've started to have a regimen of pain medication and opioids and things like that, boy, if we can address it sooner, there's a much higher rate of success. So don't wait, let's start sooner rather than later.
And over the last 3 weeks, I've decreased my pain amounts by 50–60%. The true concern is for my well-being. We'll do an exercise and then we'll heavily evaluate if it's a positive or a negative. If it's a negative, we focus on getting rid of it and finding one to replace it. So I couldn't be happier.
Love helping people, very rewarding, and a lot of times people are surprised at how much recovery they can accomplish with the right guidance.
Have less pain, better function, return to the things that they really want to do, and I think that's something that I try really hard to help with.